Hello everyone, and thank you for joining us. My name's Colin Watsonville, and in today's video we're going to talk about how to become a Medicare insurance broker. Now, I've been in the Medicare insurance industry since the beginning of 2018, right after I graduated college, and I personally helped over 1,000 people with their Medicare coverage. And you're probably watching this video because you've heard of the incredible opportunity in the Medicare industry. And that is, of course, because over 10,000 people countrywide in the United States are turning 65 years old every single day. And not all those people are going to need Medicare, but once you turn 65, everyone automatically becomes eligible for Medicare. So the market is booming. There's a ton of opportunity out there from an insurance agent perspective to make a good income and career for yourself, while also having endless number of people at your disposal that you can help out with something that's very important and something they need clarification on, because Medicare is unlike any other insurance they've had their entire life. So how do you start helping these consumers? How do you start helping your fellow Americans with their Medicare coverage? Well, first off, you need to get licensed. And before you get licensed, I strongly recommend taking some sort of crash course, maybe a 2-day in-person workshop event or an online study program through a myriad of different vendors that's available to help you pass this test, because it's a very challenging test. It only takes a 70%, I believe, still to pass this test, yet most people fail this test on their first try. So the first step in the process to becoming a Medicare insurance broker is to purchase a self-study course or in-person study course to help pass your life and health exam. And once you've completed that course, you should be pretty knowledgeable about all things life insurance and health insurance. And then you will need to go and actually take your life and health insurance test with your state. It's going to vary state by state, the pricing, the times available, all those things, but just do a quick Google search for your specific state, how to take the life and health insurance exam for your state, and you'll be able to find out really quickly and easily how to register and take this exam. So those are steps 1 and 2. Find a pre-study course for the life and health insurance exam, and then take and pass the life and health insurance exam for your state. So step 3, you've submitted your results, you've passed your exam, you have your insurance license in hand. Now what? Well, of course, you have to find products to offer to consumers and sell to consumers, right? You need to be able to help them out by offering them, X company's plans and Y company's Medicare drug plans, et cetera. So before you can start getting contracted with all these insurance companies, you actually need a step in the middle. After you pass your exam and before you do your contracting and getting appointed with different insurance companies, you need to purchase something called E&O insurance, Errors and Omissions insurance, because none of the insurance companies will allow you to offer their products and start helping consumers if you're not properly insured. So this is actually a necessity. It's good to have anyway. You want to make sure you're covering your butt if you make any big mistakes and someone tries to sue you. That's what this Errors and Omissions insurance is for. And that'll run you as a new agent roughly about $300 to $500 for the whole year. Okay, so you have your insurance license, you have your necessary insurance for yourself in case you make any errors or misrepresent a plan to a consumer. Then you have protection against yourself. And now once you have that insurance, you can go out and get appointed with and get contracts with different insurance companies. And how do you do that? Well, you can't just call up these multi-billion-dollar companies usually and say, hey, I want to sell your product. It doesn't really work that way. There's a middle ground. There's a middleman oftentimes between yourself and these huge insurance companies. So you can't just call up insurance company and get contracting paperwork. You need to go through this middle ground, a third party, if you will. Now this can be done one of 2 different ways. Let's say that you want to align yourself with an established brand or an established agency in town, or maybe just in general, nationwide, or in your kind of markets, in the region that you kind of live in. Then what you want to do is find an insurance agency that has a team of agents with them or is looking to get agents underneath them, and align yourself with that agency. So they will be able to give you all the contracting paperwork. They'll be able to help you with product training and knowledge. They're the ones you can go to with any questions. They'll help make sure you stay compliant, which is good to make sure you don't have to use that E&O insurance we just talked about in the last step. They'll hook you up with company emails. They'll make sure that you have quoting software and quoting tools that you need to actually help your clients to run prescription drug checks and make sure all their doctors are covered in network. So finding a general agency is, in my opinion, kind of the best way to get started, because once you pass your life and health insurance exam, you still don't know anything. I'm going to be completely honest. The real training comes with actually being in the field and helping consumers and being able to understand the products that you're offering through a more niche route rather than just broadly knowing the industry with taking your life and health insurance exam. Now, not all general agencies are the same. Sometimes some of them will give you free leads for a cut into your commission. Some will, pay for things like business cards and that quoting software and a CRM to manage all of your customers' information in an online secure database. So the setup with general agencies will be different. Some will just pay you a W-2 salary and then maybe a bonus on top. And other general agencies will let you do full commission and have no cap to your income that you make. So there's a bunch of different setups between general agencies. So this is the point where you probably want to take a pause and really shop around for a good month, maybe even a couple months, to find which agency will work for your current situation, which one you think can provide the best help and mentorship and guidance to hit the ground running and has a proven track record of giving other agents a good path to succeed. And of course, this is where I should plug my agency, Modern Health Solutions. We're always looking to bring on more insurance brokers, especially on the Medicare side of things, and we have the opportunity to work remote. So wherever you want, wherever you feel comfortable, that's where you can work from. So that's one route you can go down, is the general agency route. But if you're feeling bold and brave, or maybe you have aspirations to create your own agency and brand, either immediately or down the road, then you can skip the general agency level and go to the top of the ladder. So I want you to think of kind of three levels here. There's you at the bottom. You're the street agent. You're the one actually going out and helping consumers with their Medicare. And then above that, if you want, is a general agency, again, that can help you with all sorts of stuff we just mentioned. But if you don't want to go to the general agency for whatever reason, then you can skip them and actually go to the top of the food chain, and those organizations are called FMOs or IMOs. Those are the ones that have not only thousands of agents underneath them, but thousands and hundreds of agencies underneath them. They're more focused, really, in my opinion, on helping the agencies grow, making sure the agencies are staying compliant, making sure the agencies have answers to questions with commission tracking and up-to-date industry changes. So the FMOs and IMOs really are built for helping the agencies, the general agencies, and not so much geared towards helping the individual, work from home mom and pop insurance agent. But if you want, you can still go directly to those guys, and they'll be able to help you get contracts with all the different insurance companies that offer Medicare products. Okay, that was the most complicated part. I promise it's going to get easier from here. So you found out your hierarchy structure, you know which route you're going to go down and who your upline will be, and then those organizations will be the ones to help you start getting contracts with the insurance companies. So while all that paperwork process is beginning, what you want to do now is go out and get your annual Medicare certification. There's a lot of testing involved here. So not only did you get your life and health insurance license, but you also need to complete an annual Medicare training, the most popular of which at the time of recording this video is called AHIP. That'll cost you roughly $150 every single year, and that will include your mandatory fraud, waste, and abuse training. It'll include the updates to Medicare. It's also just a great way to learn about Medicare and the different parts of Medicare, and provides a great training to any new agent and seasoned agents to explain, the different rules, the different enrollment periods, what happens when someone has a special enrollment period, what are their options, when can they switch plans. So AHIP, your annual Medicare training, that's something that you'll need to knock out and complete before all of your contracting paperwork with the insurance companies can be finalized and before you can begin selling their products. In addition to that annual Medicare training and certification, you will also need to go and complete each individual carrier's certification. Now, it's not a lot. Most agents can get away with maybe 5 or 6 insurance companies, depending on where you are in the country. So you might need to complete, a handful or 2 of extra carrier-specific certifications. And again, those will be done on an annual basis. There's some testing involved with some companies. Others, it's just checking a box to acknowledge and attest that you read and understand the materials. But yeah, there's 2 trainings that you'll need to do before you can actually begin selling a company's products. The annual Medicare training through AHIP, and then also that carrier's specific certification training. And that's it. That's the end. That's the finale. Once you get the green light from an insurance company stating that you are ready to sell status, then you are just that. You're ready to go sell. You are eligible to now go and offer their Medicare products to consumers. Now, I know that was a lot of information and this is a long video, but let me lay it out simply and summarize it for you here very clearly. This is a step-by-step process how to become a Medicare insurance broker. First off, you need to find and take a study course that will help you then pass your life and health insurance exam with your state. The study course will cost you maybe a couple $100s, and then depending on your state, it might be $50 to a little over $100 to actually take the life and health insurance exam. Step number 3 is purchasing your Errors and Omissions insurance, E&O insurance, and again, that will cost you between $300 to $500 roughly for the whole year. And once you have your E&O insurance in place, you'll want to find your upline, your hierarchy, either align yourself with a general agency or go directly to a big national FMO, and then either of those routes, you'll then be able to do the next step, which is get your actual insurance contracts, where you are beginning the paperwork process of getting appointed with each of the different individual Medicare insurance companies. And with that, part of the process of getting appointed with each individual insurance company is doing an annual general Medicare certification and training. Again, most people do that through AHIP. That'll cost roughly $150 every year. And then in addition to that training, you will need to do individual carrier-specific certification training with every insurance company you plan to offer their Medicare products. And those don't cost anything extra, but they are kind of tedious. They're usually pretty easy though. And once you complete those certifications, once your paperwork goes through for the contracting and appointments, then you receive the ready to sell status and you have the green light, the go ahead to actually now help consumers with their Medicare coverage. I know it sounds complicated and difficult, but I promise you it's really not. If you follow the step-by-step process, then you are guaranteed to be up and running and ready to help consumers probably in just about 2 short months. And once again, if you would like assistance with this and would like to join our team, my agency is called Modern Health Solutions. All of our information will be down below. So that's going to be a wrap for this video. Thank you so much for watching. If you enjoyed content about Medicare, health insurance, or employee benefits, then hit the like button and consider subscribing to stay up to date on all of our videos. Leave your thoughts and comments down below. Share this with a friend or family member who might enjoy it, or even just follow us on your favorite social media platform. Once again, my name's Colin Wattenville, and I own Modern Health Solutions. Thank you so much for watching, and we'll see you soon.